Welcome to the NorthLakes podcast. I'm Jeremy Oswald. For this, the 30th installment, we will be talking about weight stigma with behavioral health therapist Megan Collins and registered nurse and clinical quality improvement manager Lori Cannon. Let's meet Lori and Megan.
Hi, I'm Megan Collins. I'm a behavioral health therapist. I see mostly adults, a few kiddos. I've been at NorthLakes for just shy of 9 years. August 1st is my anniversary.
Hi, I'm Lori Cannon. I'm the clinical quality improvement manager. And so I work on a variety of medical workflows and processes, making sure that we're kind of meeting our standards that we set for ourselves and some that other people set for us. And I've been here for about 5.5 years.
You have a medical background?
Yes, I'm an RN.
Great. That might factor in later.
Yeah, a little bit.
I am a NO, nothing. Today, I wanted to talk to you both about weight stigma. And Megan, I think you had a definition to get us started.
Yeah. So weight stigma, which is also known as weight bias or weight-based discrimination, is discrimination or stereotyping based on a person's weight. And Lori, does that sound right to you?
Yes.
So why is it good that we're talking about it? Why is this going to be a relevant podcast? Why should we be discussing this?
Well, for one thing, NorthLakes has been working on a bunch of trauma-informed practices and sort of working to get those into our clinic spaces. And this is a component of that. And so we're doing some active work to try and decrease weight stigma within our clinic spaces and make sure that we're welcoming to patients in all bodies.
And so how are people experiencing this? What's a common occurrence of weight stigma?
I think it shows up really across settings, no matter where people go. It can be experienced by a person who lives in a larger size body who doesn't fit comfortably on a plane seat to someone who is passed over for a job because of the size of their body, to someone who just endures sometimes it can be stares or just bullying or comments from people that are unkind about the size of their body. And certainly, because we're talking about the clinic setting, it can show up in a variety of ways in a medical setting, just in terms of, is there comfortable seating in the waiting room to is the provider who brings them into the room comfortable with them saying no thank you if they don't want to be weighed that day, those kind of things.
That's usually the first thing that happens after you check in. The first kind of medical moment is you get weighed. Yep. Why do we start with that? Why does that happen?
I think that's a good Lori question.
Yeah. So there can be some really excellent reasons to be monitoring somebody's weight. Somebody who is having cardiovascular issues, particularly heart failure, rapid weight gain is a sign that they are having more significant issues with their cardiovascular system. So that's one example. I think if we see sort of that unexplained weight loss, that's always a red flag. And it deserves further investigation. And, sometimes it's just kind of what we do. And that that can be worth taking a look at and seeing, is this something that needs to happen? Or does the patient need to be involved in being weighed? And so what I mean by that is, do they need to know their weight? Do they need to know if they've gained 5 pounds over the last year? Do they can we have them step on the scale backwards so they don't have to see their weight if it's very triggering for them? Can we put the scale in kilograms instead of pounds so that it's less of that kind of visual sight for most people? So there are a variety of options for weighing somebody who, it's more sensitive for them, but it's not necessarily a medical requirement. And so having that conversation with the provider, if it's something that is upsetting or bothersome to you.
So I go to the doctor and, I guess I'm trying to think back. In the past, I've heard somebody go like, oh, geez. Or, it's like it probably doesn't need to take much for someone to get a reaction, that's not the word I'm looking for, to be affected by a comment.
And you may not see it in the moment because that person is probably very good at masking their reactions to that. And I know I have an example of a client I work with who lives in a larger body and was weighed, and the person who weighed them said, "Oh, I'm so sorry."
Oh, geez.
Yeah. So she had to navigate that and continue on with the appointment and act like she was okay. And she wasn't.
I think, too, one of the things that we see in our society is weight loss is just assumed to be a good thing. People if you lose weight, somebody will say, "Congratulations, you look great." And we never know why somebody lost weight. It could be due to illness. It could be due to trauma and stress that is affecting their eating. And the assumption that it's just always a good thing and you're always healthier and you always look better if you lose weight is incredibly pervasive and in the healthcare field and outside of it as well.
Yeah, well, and I'm going to just be straight up. Like, this is one of the podcasts that I'm like, I'm not familiar with it. It wasn't really, so this is an awkward conversation for me. So hold my hand, talk me through it. And, because it's, I don't know, I find it fascinating. I always love talking to behavioral health folks, and you too, Lori.
Oh, thanks, Jeremy.
Yes. But, so, I mean, it's kind of is it a hard topic? Is it just me that has a hard time talking about it?
I think it's a hard topic if you can only see one side of it. I think it becomes easier when we allow ourselves to broaden it out and really have acceptance for people no matter what size their body's in. And I think I can only talk about for me personally, as over the last couple of years, I've just delved into this more for a variety of reasons and increased my own comfort with being able to have those conversations with people, because it is socially acceptable to treat people differently when they live in large size bodies. That's problematic. And so, yes, it is a hard conversation to have until you navigate through that.
Mm-hmm. Yeah, I would say it's like any kind of new subject, that it can feel awkward and kind of goes against a lot of our ingrained assumptions and our implicit biases. Mm-hmm. And, that we're all kind of swimming in. That's why they're implicit. So, it's a process. It takes kind of that education and multiple conversations to kind of get to a place where there's good understanding and comfort with it.
So let's just maybe just to start about our world, the NorthLakes world, or the medical world. So if you're somebody that's come in and, you had that reaction after you were on a scale, and you don't probably want to talk about anything else that you were there for an appointment for. You just want to get out of there and go be, that's how I deal with trauma, not trauma. Sorry. I try to go and hide. So sure. How does that, that's got to be hard for someone coming in for care. If that's what they're thinking about, they're not really taking care of what they're coming in for.
Mm-hmm. Yeah. I think it can actually be a barrier to care.
Yes.
People don't, if they're worried that they're going to come in and get a lecture about their weight, they're less likely to seek care. And, it's one of those things where I think if you find somebody who is in a larger body, the vast, vast majority of them have tried multiple things to lose weight. And there's a lot of assumptions being made about health and habits. And so I think, it can be really hard for people to kind of get the courage up to go into the doctor knowing that there's a decent chance that that is going to come up regardless of what they're there for. I will say, I think I may be a little biased, but I do think NorthLakes does a pretty good job with this. And all of our medical providers have really embraced this initiative. We've gotten a lot of excitement and positive feedback on this, that we're working on this from our medical providers. So I think it's just, it's a fact that just lives in the world, that in the medical world, it can be really difficult to kind of come in when you're in a larger body, I think.
Yeah, and I think for sure the avoidance is tremendous. So I think if we can create a space where people can choose whether or not to get on a scale, where they can choose what the conversations are, and I think just that providers are willing to start these conversations is a good thing. And also just moving away from the standards, which are, when people live in larger bodies, they're encouraged to go on diets or start a program or see, and it's not that seeing a dietitian is a bad thing, but unless that's what they came in for, right? If someone's coming in and is talking about those things, that's fine. But if they're coming in because they're congested or they have, or whatever their problem is, then the focus should be on that and not the size of their body.
So what brought about kind of this program, and how did you roll it out, and how's it going?
This is something that I have had a lot of passion for a while, and we do a lot of kind of conversations with other health centers in Wisconsin through the Wisconsin Primary Health Center. Lake Superior Community Health Center did a big decreasing weight stigma project. And one of my colleagues from there was on one of our quality meetings through WIPCA, and this was November or December, I think, of last year, and was talking about the work that they had done. And I got really excited and reached out to her and kind of pulled some other people here in, and it's been a really slow process. We're trying it's not necessarily a quality improvement project. It's more along the lines of that trauma-informed practice that we're working towards. So we're calling it an initiative versus a project. But our QI assistant did lunch and learns with medical staff in March, kind of explaining what weight bias and weight stigma is and how they, what role they can play in helping to decrease that. We're asking managers to do kind of an assessment of their clinic furniture, make sure that we have plenty of seating available, sturdy exam tables, so that there isn't that kind of awkwardness of, will this hold me? For patients, we want them to be comfortable. And Megan is going to be doing some lunch and learns with providers to kind of get that conversation opened. We've got some really beautiful signs that your department has put together that's going up in clinics. And so it's just sort of this longer term process that we're just kind of trying to have this conversation around and make it something that we're all kind of aware of.
So here's something just to get a little bit deeper, and I'll just read it as I wrote it. Here are two different phrases that I hear, body image and weight stigma. Are they the same thing, and why or why not? So body image and weight stigma certainly can go hand in hand. So body image is kind of that sort of sense of how do you see your body? How do you see yourself? What do you think about and feel about the body that you live in, right? And weight stigma is what we've been talking about. So if you can have a person who lives in a larger size body who struggles with body image, but you don't have to live in a larger size body to struggle with body image. Many people do. So they're not the same thing. Got it. I'm sorry. I always I'm a podcaster. I'm not a professional.
Yeah, no, it all
provider.
Connects.
Yes.
Yeah. And there's a lot of kind of buzzwords and things that go around. So, body positivity is another thing you'll see. Body neutrality is another that's kind of starting to take hold a little more. So there's lots of different terminology and.
Got it. And that's one of my favorite things about doing this is I get to learn right along with everyone else, but I have you guys right here with me, which is, I'm lucky that way. So what else? If someone is experiencing this, what can they do? If they're like, that's got to be hard to to advocate for yourself anywhere, but in healthcare, we come in and just like I'm in awe of the two of you being the healthcare professionals you are. But if you're seeking care and you come in and you're kind of experiencing this, I'm not really being treated well because of this, any advice or what could or should someone do?
So there are a couple options. I think more people are starting to kind of look for providers who are providing that sort of health at every size care. You can also, if you're establishing care with a new provider, there's often an opportunity to write down anything you want your provider to know, either if you're registering on my chart or if you're coming in and filling out a paper form. And so you can say something like, these are my eating habits, these are my physical exercise habits, and I do not wish to discuss my weight beyond health, like my actual health. So, and then, if they don't respect that, then you find another provider, but most providers are going to respect that. And I think, looking for things like, do they ask you about your diet? Do they ask you about your physical activity? Or do they make assumptions and say, you should really start walking when in fact you're running half marathons? Because that happens. And, you just want somebody who's got curiosity instead of that kind of fixed idea of what a person in your size body does for their habits.
So, I mean, that's kind of good advice for anything,
Yeah.
Yes, if I don't know why I'm saying, if I came in with only one eye working, to make assumptions about how it happened or anything, you wouldn't do that, right? You would probably be more curious and not just put assumptions and, I know how you did that.
Lawn darts, right?
Yeah, right. Yeah. That's children of the 70s.
And I think that shift to curiosity is really one of the most important ones, so that because all of us are going to initially, because we are human beings, so we see with our eyes and we do make some assumptions or at least some judgment that we're not even registering necessarily. So we're asking ourselves to move beyond that and just get curious, no matter what the person who walks in the room looks like, because then that allows us to, instead of, and even shifting things from asking people about their diet, checking in with, what's your relationship like with food? Are you satisfied with that? Does that feel good to you? Are you, being able to support people to sort of talk to you in different ways because they hear the language coming from you, because that really opens the door. Because when we use language, even language around diets, really brings in a lot of triggering shame for many people. And things that are neglected sometimes, I think, are the toxicity of diet culture and the fact that it doesn't work, right? And you have people who are yo-yo dieting and actually doing more damage to their health than than being whatever size their body is and finding comfort around that and bringing into the room, well, what does your family look like? What are your genetics? What other things contribute to the way that your body looks, and understanding that they are impacted by all of the message they get around them, messages that come from everywhere about, what a good body is and what a bad body is.
Yeah, for sure.
To not have those assumptions, that this is what we're supposed to look like. This is what we're supposed to be. That shouldn't fit here.
Right.
Yep. And just because a person walks in a larger body doesn't mean they have a problem with that.
Correct.
And I guess, that's where I guess I was going with the body image and weight stigma. That's what I was thinking, is that if you're good with who you are and what's the problem? But then I guess the problem would be if a doctor's asking you, or some kind of provider is asking you those weighted questions, or that are coming with assumptions, then all of a sudden you're like, oh, why? Maybe I should be self-conscious about this. So you walked in without it and you walk out with it.
Yeah. And I think, that's one of the things, is that we are kind of moving towards a model where we talk to all of the patients that come in about nutrition and exercise and separate that from weight. So we're all going to feel better if we're eating more vegetables and fruits and whole grains, and we are getting regular physical activity. Everybody's going to feel better with that. And they may or may not lose weight, and that's fine, but they're going to be healthier regardless. And so that kind of separating that weight from health, because you can be within the quote unquote normal BMI range and be extremely unhealthy. You can just have a really good metabolism, but you eat 10 pounds of candy a week. That's, even if you're not gaining weight, that's really bad for you. So just pulling those two apart, and it's hard because they are so linked in our minds and the way that society portrays it. But we're trying to pull that apart and just encourage everyone to eat as healthy as they can and get as much physical activity as they can. And, and then your body will set itself where it wants to be.
And even with that, I think there has to be a little sensitivity around how we talk about food, because people will come in who, if we look at those social determinants of health, what do they have access to? What can they do? And you can sit and talk with them for as long as you want about, eating fresh vegetables and, but do they have access? Which is why some of those conversations, starting with curiosity, can be so very helpful. And also, if you happen to be talking to a person who has an eating disorder, you may not know that, but they're, again, perhaps if you start with talking about that relationship with food, some of that might come to the surface, and at least a little bit of the part of them that holds shame around that might step back a little, and they might be able to sort of move forward with you if you can join them first.
And not that I'm one to preach about anything, but that's a good way to look in the world too, because somebody here taught me, or somewhere along the way, it's you don't know anybody's story that's walking through the door, no matter where you are. Could be the grocery store, the library, or NorthLakes Community Clinic. So I think that having curiosity instead of immediately oh, I got that person figured out, I think is good advice, not only in healthcare, but walking through the world.
For sure.
Yeah.
So it's great. We have a behavioral health provider and a medical provider here.
Oh, I'm not a medical provider.
A medical person with a medical background.
I'm in the medical world.
Yes. Thank you. How are you able, Megan, to collaborate with, or do you collaborate with your medical partners here around weight stigma? Has there been any chance for you to do any collaboration?
I don't think there really has around this, although it is something I have been curious about. I hope to start a group for people who are navigating some of these things hopefully next month. And it'll be interesting just to see in terms of referrals that I get. I mean, it's going to have to be NorthLakes patients. But hopefully that opens that door a little bit more. And also perhaps doing the lunch and learn, things like that, just helps us connect. Because again, I think it's something that it isn't quite the same as, if we have shared patients that have substance use disorder or have mental health stuff, and, somehow that flows a little more easily than specifically weight-related things.
Got it. So what's it like? Have you had patients come in that have been on the bad end of weight stigma? And if so,
sure.
what? So what's that like for them, or how can you help them, or how does that affect their health?
So I think what it's like for them is kind of all of the things that we've been talking about, whether it's experiences that they have had when they've seen providers here or elsewhere, or just out in the world. So I think a lot of it is providing a safe space where they can talk about it openly and have conversations where there really isn't any judgment. There isn't, and just helping them and helping normalize that, and also allowing them to recognize it's not their fault that societally, because of all of the stigma that's attached to it and diet culture, and they've sort of been sold a bill of goods. And then, of course, they have whatever connects with that as well. Sometimes it connects to trauma, sometimes it doesn't. But it's, I think, being able to, again, at least have one place or an additional place. Hopefully people have other places where they can talk about it and get some support. And that's what I'm also hoping that a group will provide, more peer-related support too. That's got to be nice that they can talk to you. It's got to give people, well, in many different ways, give people relief. I hope so. And it's a privilege when somebody comes in and they can share about whatever that they're happen to be going through. And I think that for me, part of learning about this is certainly my own lived experience, but also through the lived experience of clients who come in and share what their lives are like around it.
So who does this affect? Is it, is there a certain type of person, or who feels this? Who's getting the brunt of this?
All of us. We, I constantly hear people talking about their weight or being bad, because they have a cookie, or, being upset because they gained 3 pounds on vacation. And, it affects everyone, because it's not just that people in larger bodies are dealing with weight stigma. There is an assumption in our society that there is just something wrong with being in a larger body. And it's, there are people who it's the worst thing they can think of. And living with that kind of fear is not fun. Living with that kind of judgment for people who are in a larger body, it's everywhere. It's everywhere you go. Like Megan was saying, the stares, the bullying, the assumptions, the commentary. It's so pervasive, and it's harmful to everyone, because it's this thing that it's sort of insidious. It just kind of seeps into the way we move through the world. Yeah. And
it's weird too that, that people still feel comfortable just shouting it out on the street, or, if there's someone that's a different race or age, or, no, you don't do that. But somehow this is still, I'm doing the air quotes, okay, which it's not, but that's odd, isn't it?
Because it is socially acceptable. That's why those things happen, is because it is just a sort of across the board. That's the message, right? There's a lot of, because so much of the information that's out there and has created all these like rules around like food. And like I said, I think the toxicity of diet culture, which is a bazillion-dollar industry, has created a lot of it and really has a lot to gain from continuing that, right? So if fat can be bad, then we can treat it any way we want because that person clearly doesn't have any willpower, doesn't take good care of themselves, is lazy, all of the words that can connect to that. And there still is so much like, yep, that, people that will buy into that.
Yeah, I think, a lot of people my age are talking about the way we grew up with, our moms on Dexatrim and drinking Tab and, all of the kind of old cheesy diet cultures, all the things that really didn't work long term.
None of them work long term.
No,
not
I
then,
know. No,
not
nothing.
now.
Nothing
None
works.
Of them.
No, I think it's been pretty well established.
Yes.
Yeah, and there's a real kind of growing understanding of how harmful that was to us growing up, seeing that and seeing our parents who, were perfect in our eyes, criticizing themselves. And so I know, I have a 10-year-old. I am very conscious all the time. We never criticize our bodies. We never criticize other people's bodies. We don't talk about other people's bodies. And they, they're still 10, so puberty's coming. We'll see what happens. But they have a confidence that I don't recall as a 10-year-old. Just and in a physical space, there's a confidence there that I hope is kind of becoming more and more the norm. I think it's going to take a lot to kind of work through all this.
And it's good to remember that's what we come into the world with, right?
Yes.
We love our bodies when, if you watch a baby exploring its fingers and toes, and then, even just the delight that they have with mirrors as children are getting older, and it's whatever surrounds them, right? That is what, and it's not just, unfortunately, it's not just parents who are paying attention to that. It's across the board. People get so many messages from so many places and start to have rules around food, whatever those happen to be, right? And then we forget that our bodies are actually designed to let us know what we need. So a shift toward, rather than go to one of these weight loss programs, to intuitive eating, like relearning, because for many folks, they've lost track of it. It's very hard to find sometimes, but it is findable. Sort of cues of hunger and noticing when we're full. And, what are the driving forces behind whatever's happening in that relationship with food, and being able to navigate that better. But yes, for sure, shifting away from some of those things. And we know 90% of any of the programs related to weight loss that we could talk about don't work over the long term.
And so you've mentioned diet culture a couple of times. And so you know more about this than I do, but I mean, is it just diet culture or just like society in general? I mean, like you look at who's on TV, who are the people we're supposed to look up to. And they're these these perfect, as here's the air quotes again, perfectly shaped people. So, I mean,
they reinforce each other. Does that make sense?
Yeah.
So, the people that we see on television and movies, wherever it is, look however they look, and diet culture, helps us to just reinforces that's what we should look like. Puts
them up on the pedestal that's what we should be shooting for, and that's why you should be drinking Tab. No offense to Tab.
Yep.
Mm-hmm. Well, and I think some of those people that you see will be very honest about it and say, "It's my job. My job is to look like this." That's not your job. Mm-hmm. Like it's not reasonable for people who have other jobs than looking good, which is it's not my job. So,
and we all look good, right? That's what we want to aim for, is that whoever you are, whatever you look like, you're good.
Yes.
That's that would be the sweet spot.
Yeah.
And and if you watch an athlete or something like that, and you're like, well, I don't look like that, so I can't do that. And that's too bad, because like all of us can play volleyball, or, you know what I mean? And everybody should if they want to.
Yep.
And not feel weird about it.
Right. And that's why, even that shift toward, well, everybody needs to exercise and needs to look like this. Well, no, not really. Right. But allowing people to explore what brings them joy in movement, whatever that happens to be. I mean, if you want to dance in the living room with the shades down and that makes you happy, do that. If you want to go to the gym, do that, whatever it is. But really having openness around it all counts.
Yeah.
And it should feel good, because why torture yourself? You can find things that make you feel good physically and emotionally.
Mm-hmm. So break down the diet culture a little bit more. That's just like whoever's trying to profit from whatever, like be who it is. They're like are there, like, you want to go deeper into it? Like, what are some of these, like, are they like fad diets, or is it just like there's like it's all a big gimmick? Or
it's pretty much all of them. I don't know if I don't know of any. I mean, could name them, but even the ones that have been around for a really long time, and you could say, well, they're really promoting healthy eating there. But what the measurement is the scale. If the measurement is the scale, then you've already lost it, right? You've already taken yourself out of the place where you can help a person genuinely be who they are in the body that they live in, and have comfort with whatever that set point is that Lori was talking about, because our bodies will find that. Diet culture encourages us to diet and lose weight, right? That's from whether it's medications, it could be surgery, it could be any kind of weight loss program. But what we know is that most people will gain that weight back, and probably a little bit more. So then what happens? They're still stuck in diet culture. So they go back to maybe a different program, right? There's always a new one coming out that promises this, that, or the other thing, right? So what happens is this yo-yo dieting cycle of weight loss, regain weight. So your body gets terribly confused about that. Mm-hmm. And your metabolism then doesn't know what its set point is. So you're actually like hurting your health, but you're also hurting yourself emotionally, because you never get there. Right? You're always striving to be a person or a body size or a number on the scale or a size clothes, whatever it happens to be, that is just a little bit outside where you can reach it.
Well, and hurting yourself as you're like, absolutely. I can't do this. So you're like, just that stress of like,
and we have this culture that says, just, you gotta have willpower. That's what it is, right? That is not what it is. It isn't about that. It has nothing to do with willpower.
Our bodies are designed to hang on to weight. Mm-hmm. That's just how we are made, because it's only in the last couple hundred years that we've had, most of us can get through a winter without worrying about whether we're going to make it.
Whether we're going to have enough to eat.
Correct.
Yeah.
Yeah. I mean, the weather, that's a separate thing. But but we have evolved to hang on to weight. And so the idea that if you just have enough willpower, you're literally fighting evolution. And it's just, I think people like to say things like, it's really simple. It's just calories in, calories out. Well, no, it's not. I mean, there's so much. Our bodies are so complex. The endocrine system is amazingly complex, and we're talking about minute amounts of hormones that one way or the other can really change how you're feeling and how your body functions. So it's just not that simple. And I think, like Megan was saying, the yo-yo dieting where you'll lose some weight, but it's going to come back on. And that affects your metabolism, but it'll also, that's hard mentally.
Yep.
Because you feel like, you feel really accomplished, but then, I'm a failure.
Yeah.
When it's just your body doing its thing.
And your mental health suffers, right? Because it certainly is a contributing factor to eating disorders, but also having that experience of you are at whatever size, you lose weight, you get accolades, and a part of you might be saying, oh, what were they thinking about me before? And then you gain the weight back and a little bit more. And then you're like, I know what they were thinking about me before because they noticed when I lost weight. So, and your brain will fill in the blanks and not kindly, right? So it definitely is that's diet culture. Mm-hmm. It has a lot of teeth.
Yeah, I like the yo-yo. That's a good way to phrase it. Thank you for that. Mm-hmm. And I don't know, like it was neat hearing you talking about kids, and like I was feeling like that a 10-year-old like right on the cusp of like I'm clutching my heart right now. Is it different for kids experiencing weight stigma, or is it like
no? I mean, I would say no. I mean, I think the degree of bullying that goes on, and again, because it is socially acceptable, oftentimes kids think it's okay, right, to pick on the fat kids or whatever it happens to be. And again, there's many contributing factors to what size a child's body is going to be, and we're not making space for that. We're just trying to say people should be cookie cutter size wise, and that's just not how it works. And how boring it would be if that was how it worked.
Yeah.
We all saw Barbie. Well, I think 85%. So if we're moving through the world, like now, like I appreciate this, and I'm going to be a little bit maybe more cognizant of how I go through the world. What's some other advice, or what could somebody listening to this, what's an easy thing that they could do to make weight stigma less of a problem in our world? And I have some thoughts, but you guys are the experts.
You mean, how can the people who are experiencing weight stigma?
No, I'd like to say maybe, so how can we be better people in the world so this isn't as big a problem?
I think allowing yourself to have awareness of sort of judgments that show up, kind of like I was talking about earlier, and just acknowledging with some self-compassion that happens, but then allowing to extend compassion, right? And just acceptance around, and asking yourself to shift that a little bit and just think about it a little bit differently, and let go of assumptions. Stay curious.
Yeah, I would agree. I think, this is something that a lot of people, we don't like to think of ourselves as prejudiced, or
mean,
or having, holding on to stereotypes, but we all do it. It's just, like I said, we're soaking in it. It's our society. And so, like Megan said, acknowledging if you see somebody and you have a thought that is unkind, acknowledging that, I'm having this thought. I don't know anything about this person. Mm-hmm. I don't know anything about their habits, who they are, what they've been through. I know nothing. And so as you start kind of retraining your brain, that's where it's going to come from. But it does take some conscious effort. I'm a huge fan of implicit bias test from Harvard. If you just type in Harvard implicit bias, it'll take you to it. There is one specifically for weight. So taking that and just getting a sense of like where your brain kind of sits, and also just acknowledging that it's not your fault. It doesn't make you a bad person if you have these kind of deep-seated thoughts. It's what we grew up with, and it's what we're living with. But we can try and change that.
And it's frequently reinforced as we walk through the world about what people should look like.
Yes. Yes.
So yeah, no, not our fault. It's something it's around us, so you can't even like get away from it.
Yeah, for sure.
Sorry, Megan, were you about to?
No.
Oh, okay. So again, like it sounds like NorthLakes is working on that. So thanks for making that happen, Lori. That's got to feel good.
Yeah, it is really exciting. When I got the kind of proofs for the posters from marketing, I was just...
Thank you, Raquel.
Yes. Amazing.
Well, I'm excited. I didn't know there were any, so I'm
Yeah,
excited to see
we're going to be putting up some posters, some up above scales and then in the exam rooms. And it just kind of gave me the warm fuzzies. And it's fun to work on stuff like this because I think this will meaningfully help patients.
Yeah, and we'll attach them to the notes of the show so that's people and everybody can take a look at them. And what was the implicit bias? Should we maybe put a link? We could do a link of that in the show notes as well.
Yeah.
Okay.
Great.
Cool. Well, I got one more question for you guys, for you people. I'm sorry. I see similarities with the podcast I did with Tamlin about pronouns.
Yeah.
And it's just like, it's another easy thing that we can all just change the way we look at the world and understand it a little bit better. So then we understand ourselves better. And then we're like making the world more welcoming for our fellow humans. So there.
Yeah.
Agreed.
But Megan, what's in your car right now?
What's in my car right now? A dog car seat, a towel.
A dog car seat?
Yeah, I have a little dog. She likes to be able to see.
Oh.
And I like her to be safe, so I clip her in.
Oh. That made my day.
Anything else that you want to share? You don't know, no pressure.
Some paper towels. The snow brush just never leaves the car. No. It's always there.
We are recording this in July for those who are keeping track. How about you, Lori?
So much sand. Yeah, that's really so much sand.
You got a sand truck.
Yeah.
Awesome. Well, Megan Collins, Lori Cannon, thank you for talking about this. Thank you for being here. It's always good to see the two of you, so thank you very much.
Thanks for having us.
Thank you, Lori and Megan. I hope I'm not the only one who feels like their lens of the world has been slightly altered after listening to this episode. You can see the posters that NorthLakes displays in our clinic to address weight stigma in the show notes, as well as a link to the implicit bias test that Lori talked about. NorthLakes Community Clinic is a federally qualified health center that is located in several communities in Wisconsin. We see all people, accept most insurances, including Medicaid and Medicare, and offer a sliding fee scale to those who qualify. You can learn all about NorthLakes by visiting our website at nlccwi.org. My name is Jeremy Oswald, and I am a marketing and communication specialist at NorthLakes. Have you given a review of the NorthLakes podcast on the channel that you listen to this on? It would be great if you did. Thank you in advance, and thank you for listening.